What if healthcare's biggest lesson is not coming from a new drug, a new technology, or a billion-dollar investment? What if it comes from a little girl in Adelaide, Australia, whose life depended on hundreds of people connecting the dots? When Mia Fulgencio and Brett Fulgencio welcomed their daughter Thea Hattersley in South Australia, they never imagined their journey would be defined by hospital rooms, uncertainty, and a fight for survival. Thea was diagnosed with biliary atresia, a rare and life-threatening liver disease. Her early life was spent at Women's and Children's Hospital in Adelaide, surrounded by physicians, nurses, transplant specialists, and caregivers working toward one goal, giving her a future. Her survival was not because of one person. It was because an entire healthcare system connected. A medical team coordinated complex decisions. Nurses provided constant care. Specialists shared information. Laboratory teams, pharmacists, and support staff played critical roles. An anonymous donor family gave Thea a second chance through organ donation. The transplant was extraordinary, but the deeper lesson was the system behind it. Healthcare knows how to coordinate miracles. So why do so many physician practices still struggle with everyday operations? Why can we successfully perform life-saving transplants, yet physicians spend hours chasing denied claims, fixing documentation issues, and fighting administrative complexity? The problem is not a lack of medical expertise. It is disconnected systems. A patient visit does not end when the physician leaves the exam room. It continues through documentation, coding, insurance verification, claims, and payment. When those connections fail, physicians pay the price. Most billing problems are not really billing problems. They are information problems. A missing detail, a workflow gap, a communication failure, a preventable mistake that appears weeks later as a denial. Medicine believes in prevention when treating patients. Healthcare operations need the same mindset. The future is not simply better denial management. It is preventing denials before they happen. As a physician and founder of Oncs, I believe healthcare does not need more disconnected technology. It needs smarter connections between clinical care, operations, and financial sustainability. The purpose of artificial intelligence is not to replace people. It is to give healthcare professionals their time back. Thea Hattersley's story reminds us that better outcomes happen when people, information, and systems work together. The question for healthcare leaders is, if we can coordinate a child's life-saving transplant, why can't we create systems that make everyday care easier for physicians and patients? What is the biggest administrative barrier preventing your practice from delivering the care experience you want? Share your thoughts in the comments. If this perspective resonates, share it with another physician or clinic owner who believes healthcare can work better.